Bismillahirrahmanirrahim. Assalamu alaikum. Dr.S.M.Zafeer with you. In the month of April and June 2020, the time when the COVID-19 pandemic was at peak, 2 newborns of COVID-19 positive mothers were admitted under my care in the intensive care isolation unit. Both babies remained well discharged after 14 days. In this video, I am going to share with you mothers' anxieties and their questions. Answer is given according to the available information on July 15, 2020. For latest informations and updates, please go through the websites of WHO and CDC. Newborn of COVID-19 positive mother. For public awareness, please subscribe my videos to get more informative videos regularly. Just brief about the coronavirus. Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus in December 2019. The incubation period for COVID-19 is the time between exposure to the virus, becoming infected, and symptoms onset. Is on average 5 to 6 days. However, can be up to 14 days. During this period, also known as the pre-symptomatic period, some infected persons can be contagious. Therefore, transmission from a pre-symptomatic patient can occur before symptom onset. The most common symptoms are fever, cough, body pain, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and even death. The period within which the symptoms would appear is 2 to 14 days. It is not known if a pregnant woman with COVID-19 can pass the virus to her fetus or baby during pregnancy or delivery. To date, 6 May 2020, the virus has not been found in samples of amniotic fluid or breast milk. Pregnant women keen to know, and they have some questions which I am going to share with you. Question: should pregnant women be tested for COVID-19? Testing protocols and eligibility vary depending on where you live. However, WHO recommendations are that pregnant women with symptoms of COVID-19 should be prioritized for testing. If they have COVID-19, they may need a specialized care. Question: do pregnant women with suspected or confirmed COVID-19 need to give birth by cesarean section? No. WHO advises that cesarean sections should only be performed when medically justified. The mode of birth should be individualized and based on women's preferences, alongside obstetric indications. Question: can babies get the coronavirus disease? It is possible for people of any age to be infected with the virus, but so far there are relatively few cases of COVID-19 reported, 1 to 2% among children below 9 years. Question: what care should be available during pregnancy and childbirth? All pregnant women, including those with confirmed or suspected COVID-19 infections, have the right to high quality care before, during, and after childbirth. This includes antenatal, newborn, postnatal, intrapartum, and mental health care. A safe and positive childbirth experience includes being treated with respect and dignity, having a companion of choice present during delivery, clear communication by maternity staff, appropriate pain relief strategies, mobility in labor where possible. Question: can I touch and hold my newborn baby if I have COVID-19? Yes. Close contact and early exclusively breastfeeding helps a baby to thrive. You should be supported to breastfeed safely. with good respiratory hygiene. Hold your newborn skin to skin and share a room with your baby. You should wash your hands before and after touching your baby and keep all surfaces clean. Question: can women with the coronavirus disease breastfeed? Yes. Women with COVID-19 can breastfeed if they wish to do so. They should practice respiratory hygiene during feeding, wearing a mask, wash hands before and after touching the baby. Routinely clean and disinfect surfaces they have touched. Question: can pregnant or postpartum women transmit the COVID-19 virus to their unborn child or infant? There are few data on the clinical presentation of COVID-19 in specific populations, such as children and pregnant women, but findings from a small published study suggest that there is currently no evidence for intrauterine infection caused by vertical transmission in women who developed COVID-19 pneumonia in late pregnancy. Question: are pregnant women at higher risk from COVID-19? Research is currently underway to understand the impacts of COVID-19 infection on pregnant women. Data are limited, but at present there is no evidence that they are at higher risk of severe illness than the general population. However, due to changes in their bodies and immune systems, we know that pregnant women can be badly affected by some respiratory infections. It is therefore important that they take precautions to protect themselves against COVID-19 and report possible symptoms including fever, cough, or difficulty breathing to their healthcare provider. WHO will continue to review and update its information and advice as more evidence becomes available. Question: how to disinfect houses of COVID-19 patients? Environmental cleaning in healthcare facilities or homes housing patients with suspected or confirmed COVID-19 infection should use disinfectants that are active against enveloped viruses and other coronaviruses. There are many disinfectants, including commonly used hospital disinfectants, that are active against enveloped viruses. Currently, WHO recommendations include the use of 70% ethyl alcohol to disinfect reusable equipment like thermometers between uses. Sodium hypochlorite 0.5% for disinfection of frequently touched surfaces in homes or healthcare facilities. Are masks effective against the coronavirus disease? Yes. If you are healthy, you only need to wear a mask if you are taking care of a person with suspected COVID-19 infection. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub for 20 seconds or soap and water for 40 seconds. If you wear a mask, then you must know how to use it and dispose of it properly. What is the recovery time for the coronavirus disease? Using available preliminary data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks and is 3 to 6 weeks for patients with severe or critical disease. Question: can the coronavirus disease spread through food? Current evidence on other coronavirus strains show that while coronaviruses appear to be stable at low and freezing temperatures for a certain period, food hygiene and good food safety practices can prevent their transmission through food. Question: can you contract the coronavirus disease by touching a surface? People could catch COVID-19 by touching contaminated surfaces or objects and then touching their eyes, nose, or mouth. Can patients with suspected and confirmed COVID-19 infection be cohorted in the same room? Ideally, suspected and confirmed COVID-19 acute respiratory disease patients should be isolated in single rooms. However, when this is not feasible, limited number of single rooms, cohorting is an acceptable option. But a minimum of 1 meter distance between beds should be maintained at all times. Thank you. Stay blessed.